Erectile dysfunction is often treated like it is simply a problem with sexual performance, but the truth is much more complicated. If you are having trouble getting or maintaining a firm erection, the problem may not actually start in the bedroom. In many cases, erectile dysfunction is a signal that something else is happening inside your body, especially with your blood vessels, circulation, hormones, nerves, stress levels, or overall physical health. An erection depends heavily on healthy blood flow. When you become sexually aroused, your brain sends signals through the nervous system that cause the blood vessels in the penis to relax and widen. This allows more blood to enter the erectile tissue. At the same time, the veins that normally carry blood away become compressed, helping maintain firmness. When this process works properly, an erection can develop and remain firm. But when blood vessels become less healthy or circulation becomes impaired, getting and maintaining an erection can become much more difficult. This is one reason erectile dysfunction should not simply be dismissed as a normal part of getting older. Age can increase the likelihood of developing erectile difficulties, but erectile dysfunction itself is not an inevitable part of aging. It can sometimes be an early warning sign that your cardiovascular system needs more attention. Conditions such as high blood pressure, diabetes, obesity, high cholesterol, smoking, and physical inactivity can all affect the blood vessels and circulation involved in erections. The same vascular problems that make it harder for blood to reach the heart, brain, or legs can also affect blood flow to the penis. In fact, the blood vessels involved in erections are relatively small, which means changes in vascular health may become noticeable there before symptoms appear elsewhere. For some men, erectile difficulties can appear before more obvious cardiovascular symptoms develop. That does not mean erectile dysfunction automatically means you have heart disease, but it does mean persistent or unexplained erectile problems deserve proper medical attention. Another important factor is the pelvic floor. Many people think of the pelvic floor as something that only matters for bladder control, but these muscles also play an important role in sexual function. The pelvic floor muscles help support the pelvic organs and contribute to maintaining an erection and controlling ejaculation. One particularly useful exercise for strengthening these muscles is the pelvic floor contraction, commonly known as a Kegel exercise. The basic movement is simple. Imagine that you are trying to stop the flow of urine. The muscles you feel tightening are part of the pelvic floor. However, do not repeatedly practice the exercise while urinating, because regularly stopping urine flow can interfere with normal bladder function. Instead, identify the muscles once, then perform the exercise when your bladder is empty. Lie down or sit comfortably and relax your abdomen, thighs, and buttocks. Gently contract the pelvic floor muscles as if you were trying to stop urine from passing. Hold the contraction for a few seconds, then completely relax the muscles. The relaxation is just as important as the contraction. The goal is not to squeeze as hard as possible. A controlled, moderate contraction is more useful than aggressively tightening every muscle around your pelvis. As your control improves, you can gradually increase the duration of each contraction. Slow contractions can help develop endurance, while shorter contractions can help you practice quick muscle control. The key is consistency rather than intensity. But there is an important point that many people miss. If your erectile dysfunction is primarily caused by poor circulation, uncontrolled diabetes, medication side effects, low testosterone, nerve problems,